Hello everyone. So today I'm going to talk to you about monoclonal antibody therapies for COVID-19 and the CDC guidelines for booster shots in skilled nursing, assisted living facility, and memory care units. My name is Dr. Kirk Jollis. I'm a board-certified family nurse practitioner. I will be giving this presentation. So what is the current problem? COVID numbers throughout Arizona. As you can see, from all the way from Apache County to Maricopa County having 670,000 cases, and Pima County having 132 positive COVID cases, we are seeing an uptick and an increase in the Delta variant, and this is even with many people being vaccinated. So the number of vaccinated people in Arizona currently, the total doses administered is, as of the end of September 30th, 2021, there's been 7.5 million doses administered. Total number of COVID vaccines ordered was 5 million. Percentage of COVID vaccine doses utilized, 140%. And here's what we need to know. Of 7 million doses, we're at 50% herd immunity. So we're not even close to the 80%. And you can see this average right here. This is February, March, April, and here we see October. So we have seen the spike and we are on the downward trend, but what we're seeing is the most vulnerable patients, the high-risk homebound patients, those over the age of 65, those with multiple comorbidities, those are the ones that are experiencing an uptick in COVID exposures because the kiddos are going to school, they're infecting the working adults who are working in these facilities, and then they're infecting the residents. So third dose of vaccine, what are the current restrictions? The FDA has only approved the third dose vaccine for highly immunocompromised individuals. They must meet one of the following criteria. They receive active treatment for a solid tumor, meaning they have some type of cancer. They have some type of moderate to severe primary immunodeficiency. Those with an advanced or untreated HIV infection. Those in active treatment using high-dose corticosteroids, among other drugs. And it gets very specific, even more specific for that. But needless to say, it's very restrictive. Treatment exposures in active COVID-19 cases for monoclonal antibodies. The solution for the third dose vaccine restrictions, the FDA issued an EUA, emergency use authorization, authorizing REGEN-COV for emergency use as post-exposure prophylaxis, meaning prevention, for COVID-19 in patients who are at high risk for progression to severe COVID-19, including hospitalization or death. These include individuals who are over the age of 65 or older, and individuals who have certain medical conditions, obesity, at least one chronic condition such as asthma, diabetes, seizures, hypertension, cardiac things. REGEN-COV is not authorized for pre-exposure prophylaxis to prevent COVID-19 before being exposed to the COVID virus, only after exposure. So anyone who has a possible exposure to COVID-19 would benefit from monoclonal antibodies that's high risk. The goal is keeping patients out of the hospital. So MAB, as it's called, monoclonal antibodies for short, is for anyone that's 12 years of age or older or at least 40 kilograms. So having been exposed to an individual affected with COVID-19 consistent with close contact per the CDC, those who are at high risk of exposure to an individual infected with SARS-CoV because of occurrence of SARS and other individuals in the same institutional setting, example, nursing homes, prisons, daycare centers. So basically the plan for treatment for facilities would be a three-prong approach. Vaccinate the patients who have previously not been vaccinated, administer the third dose to patients who meet current FDA guidelines. Currently the guidelines state if you've had 2 doses of Pfizer, you can have a third dose of Pfizer as a booster. If you receive 2 doses of Moderna or 1 single dose of Johnson & Johnson, you are not eligible for the Pfizer booster at this time, according to current guidelines from CDC and the FDA. Protect patients post-exposure with monoclonal antibodies. MAB is the treatment of choice for post-prophylactic exposure to individuals. For this and many more information, please reach out to our Our medical group, Priority Medical Group. Here's our information. Our website is pmgcare.com. Our email is info@pmgcare.com. And our phone number is 866-786-3999. We treat many people. We do testing, we do vaccinations, and we've treated many people who have COVID long hauler, and we tailor each treatment accordingly to those individuals and their individual treatment plans. Thank you very much. I appreciate your time and attention, and thank you for allowing this community outreach. Have a great day.